All right, quite a fun house in here, but it's health this Tuesday morning, and we're talking about something quite prevalent in in adults: osteoarthritis. Now, it's about the most common form of arthritis affecting millions of people worldwide. Now, Dr. Olatubi Olawale is here in the house, a physiotherapist, and all that. It's good to have you.
Yeah, thank you very much.
The great doctor.
Thank you very much.
Welcome.
Thank you
It's
very much.
always fun talking to you.
Yeah.
Let's get straight into it. Osteoarthritis, it's a form of arthritis, about one of the most popular. What are the causes? Let's talk about the causes first of all.
Osteoarthritis is actually the disease of the joint, of the bone. Osteo is bone.
Okay.
So the joints actually, in between the joints, there is a cartilage.
Cartilage.
So the cartilage is like the whitish from cartilage. It cushions the joints. It makes the joints move freely. And so when there is a wear and tear of the cartilage, that's where you start having osteoarthritis. Then we have pain, swelling, restriction of movement.
What causes that wear and tear?
Degenerative change is one. Degenerative.
Okay.
As you grow older, the more you use your joints, it wears and tears. Because the more you use it, because there's a friction going on there. So the cartilage is just meant to cushion the friction from going on. So when the cartilage is wearing, is tearing, at the long run, the bones start touching each other. That's where you start hearing some sound. There's something we call the crepitus sound, crack, when you move the joint.
Wow.
It happens to a lot of joints. It can happen to the knee joint, the hip joint, the fingers, the spine. But majorly, we'll be talking more on the knee osteoarthritis.
The knee osteoarthritis. Okay. As you know, he's gesturing with his fingers and all of that. Maybe, I don't know, you need to listen to this one. This is very important. Don't mind me. So, now we've talked about causes and all of that. Does it have a cure?
Yeah, it can be managed.
It can be managed.
It can be
so
managed.
there's no cure.
Because
if you have arthritis, it's for life.
It's not for life. You can make life easy for you when you have arthritis, in the sense that the cartilage is actually, it's avascular. There is no blood supplying the cartilage, so it cannot be. So when they go, what we can do is just to go there and just repair and just do so. And there are some exercises that is very, very important to be done when you have osteoarthritis. That you strengthen the muscles surrounding the joint.
That is what you can do. That's the best you can do. What kind of exercises are we talking about here?
Now I'll be using the knee as an example now.
Yes.
The knee now, the joints, the muscles surrounding the knee is actually the quadriceps, that's the thigh muscles,
okay,
the gastrocnemius muscle. All these exercises can be done. So strengthening, quadriceps strengthening exercises, just to reduce the pressure going to the knee. Actually very, very, very.
So is squats among those exercises?
Yeah, squatting. Yeah, squatting is actually among those exercises. But I usually tell people when you want to squat, you should be very careful on how you squat. Because if you have to squat in the right way when you want to strengthen your muscles.
Wow, I wish we had some space to practice this. But how about deadlifts?
Deadlifts, no. Because when you're deadlifting, you're putting more pressure on your knee. You're putting more pressure on your knee. And one of the another cause of osteoarthritis that I forgot to say is overweight and obesity.
Overweight
and obesity, because when there is a lot of pressure on the joint, especially knee osteoarthritis, the joints can no longer take the pressure, a lot of the weight of your body again. So it the cartilage keeps wearing and keeps tearing, and you start having pain, you start having swelling, you start having redness over the joint, and restricted movement. When you move, you start hearing this sound.
Okay. Is there any form of medication to help manage this?
No, when you have osteoarthritis, the basic thing is when you go to the doctor, they give you NSAIDs, that's pain relief, just to relieve the pain. And they just they advise you to reduce your level of activity. Then you refer to physiotherapy. What physiotherapists do now is to manage you, in the sense that we do some exercises, some muscle strengthening exercises and some pain relieving techniques, just to make sure that your joint is free of moves, free, you're pain free, the muscles are strengthened enough, and you're free.
So the thing now is that we find a number of people now become dependent on pain relievers, and there is now some sort of abuse. I mean, and that's why how much should one take a pain relieving medication? How far can you go? How often should you do it so that you are not abused?
Yeah, I don't blame people who rely on pain med, because when you're in pain, you just want to use everything to just bring the pain down. But most of these pain meds are actually not too good for the body when taken for too long. Because most of the time they can cause ulcer, especially the NSAID can cause ulcer. So it is advisable most of the time that you do not depend on drugs to relieve your osteoarthritis, relieve arthritis condition. So that's why physiotherapy is in place now. Why, instead of you taking drugs every time, there are some things you can do to relieve the pressure on the joint, exercises you can do, to relieve, but before then we need to examine. That's why we need to examine the extent of the osteoarthritis. Is it very, very damaged? Because when it has gotten to the severe stage, now the joint is, now the cartilage in between the joint is gone. So now the bone is now touching each other.
Oh,
that is the severe stage. So imagine two bones grinding on each other, the pain and everything. So that's the severe stage. What we now do now, okay, they can now do total knee replacement, total joint replacement in the knee. They can now, the surgeons can now say, okay, now I think we can no longer manage this. Let's just do the surgery, replace the knee joints.
The knee joints. And that's really quite something. So moving on now, we've talked about managing it and all of that, having a physiotherapist and doing all those little exercises. But there's something you mentioned which I picked on. You said reducing the use. That with much use, that's when I think burns off. I would have expected that. You know, if you're very active and all that you're probably strengthening that joint.
Yes.
But then. So there's that, Okay,
I think I was meant to say that what causes osteoarthritis is overuse of a joint. Overuse of a joint. Most people, especially fashion designers, most of it's for knee arthritis now. They've always been on the machine and pressing. Oh. They've been using the joints. So they come now with knee osteoarthritis. Drivers, pressing the brake every time, long-distance drivers come down with osteoarthritis. So overuse of a joint will cause this. So it's not always, I don't really try to tell people not to use the joint. You should be active because the more you have been active, fluid goes around the joints, it lubricates the joints, you are good. But do not overuse the joints. Do not overuse the joint in the sense that when you're using the joint, you just be careful when you're using the joint. Do not overuse the joint. That's what I tell people. Do not overuse the joint.
Okay, do not overuse the joints. Like you mentioned, driving. So, it depends also if you're driving manual and then your car. The one that you've not worked on your brake and it is just hard and all of that. But I remember last time you mentioned something that whenever you're doing something that is too routine, that you have to learn how to take a break.
Yes. I was saying that last week, guys. When you're doing something, especially when you are sitting in a position for too long, take a break. Take a break is going to help you. Even if you are sitting for too long, people with osteoarthritis, they can tell you that, oh, I'm always in pain, but after I stand up, I take some steps, the pain reduces. That's one thing. That's one of the difficult. If you take some steps, fluid grows to the joints, there's a lubrication of the joints, and the pain goes down. I tell people when you wake up in the morning, before you just start walking, just move your leg. Just try to move your leg. Make sure that fluid is going to the joints. Synovial fluid is going to the joints. It's being lubricated. Then there's easy movement of the joints.
Okay, thank you so much, doctor. And this is quite enlightening.
Yeah, thank you.
And I hope my guys behind the scene were able to get this, even though almost all of them are on their phones. But I know they definitely will probably go check out the replay. This will probably be up on YouTube. Thank you, doctor.
Thank you.
It was good having you.
Thank
and
you
that's it. The first lap of the show was done. The second lap coming right up.